Is it true that a California white woman is suing for not being enrolled in an organization that gears towards protecting Black people? Is the recent passing of a beloved influencer yet again another story that highlights the ongoing crisis when it comes to maternal health in the US? And what about the very popular, been on the market for decades, hygiene products for women that is found to have contamination with heavy metals? And what does that potentially mean for your health? The numbers for disenrollment in health insurance is staggering, and the government radio silent. But wait a minute, there may come a time where you won't be able to find out this type of information if the government has its way and is able to block platforms like ours from telling you the truth. Wait till you hear what new law has got even Zuckerberg shook. Okay, y'all. I know there's lots going on in the news, and I'm not going to keep you long. I'm going to give you all the top bullets of things that you probably haven't heard about because you are inundated with other news top stories. But these stories are the ones that will likely directly impact your life, the ones that you really need to know about. But guess what, y'all? They may be making it harder for you to hear about these types of topics that are directly impacting your life. Why? Because it's platforms like ours at Healthy Bump Club that talk about things like these, things that you need to know that are going to impact your day to day. But guess what? There's a new law called the Prominence Law that is starting in Australia and the UK and Europe that if it truly gets passed and implemented, y'all, you may not be able to see platforms like this. So go ahead and click subscribe, give us a thumbs up, and go ahead and hit that notification bell because, y'all, things are getting rough in the social and the media streets. Let me explain. So, thank you to everyone who's joining us for the very first time. We are always glad to have new listeners on because we know that that means the information is getting further. And the more you know, the more your family know, the more your community knows. And we know that because y'all are game changers. And we are here to help you comb through all the dis and misinformation on the internets so that you know the truth and can make better decisions for your health. We're about helping you optimize your health with telling you the real truth, the evidence-based facts, the actual details of what happened. I am Dr. T, your host for today, and I'm always happy to be here with you. And of course, giving a special shout out to those of you who have been with us for a very long time and have been supporting us consistently. We see you in the comments. We love your comments and your input because this is a community. We do this together. Okay. That being said, let's get into it. Y'all. So, this prominence law that they are proposing and is potentially going to be implemented. No one is talking about this. I had to really search to find this information, and even the primary account that talked about it, I searched for that primary account. It was still low down on the search list of one of the platforms, even though it had millions of views, which doesn't make sense. So that tells me that the algorithm is not working in our favor to find out information like this, but you need to know. So what this law says that is first being worked out in Australia and then Europe and then Europe and the UK. And once that happens, the US is only going to follow along because it's only going to be in the favor of this current administration. What the law says is that to combat the dis and the misinformation, which we all agree, there's a lot of dis and misinformation out there. So no one's disagreeing with that. But this method is really deeply concerning. So what they want to do is to force legally these platforms to lower the viewing of creators like us and amplify sort of your standard media TV. Now, granted, a lot of us don't really feel like the standard traditional media sources are exactly accurate or give you full information depending on what country you're in and who owns the media. It makes a difference. And so while they're saying that by amplifying these platforms, these traditional media platforms and pushing them out forward, that they will have a better chance at controlling the dis and the misinformation. We're concerned because a lot of times they do not give you the full story, which is why platforms like this became necessary. And other creators have been soaring, especially those who are in politics, because people clearly feel that we need this type of information available to us. So make sure you keep your ears open and watch what happens, because this platform has already put out a statement to let creators know you may not be as viewable. And that's a serious issue because a lot of minoritized groups utilize these platforms also to supplement income, especially with these huge job losses that are not being addressed in the US. A lot of people have depended on these platforms. I know there's one account I follow where she lost her job and spent a couple of years and still could not find a job. And so she has become a great creator and spends her time creating and sharing just her financial decision making to try to climb back up to where she was before. So it's not just not being seen and not getting any information out, which is already very concerning, but it's also the livelihood potentially of some of the creators who depend solely on these platforms to make sure that they can pay their bills. We ain't one of those, but we definitely are here to support people who do and support us so that we can get there, so we can make this more affordable. Because y'all, it's rough in these streets. And y'all know that. Y'all been in the grocery stores, you know. Anyway, let's get into one of the other stories I definitely think you need to know about. Okay, y'all, let's talk about the Affordable Care Act, which some of you refer to as Obamacare. It's serious in these healthcare insurance streets. So did y'all know that there was a loss of, we talked about on this platform, if you don't hit us up in that previous video where we give you updates. Every time you see these update videos, make sure you watch them because I give you guys a lot of information as to what's going on. If you missed that, some of these things will be shocking to you. If you watch our other videos, you're going to be like, oh, I was prepared for that. I knew that was coming because HBC made sure I was in the know. Okay. And that's what we do here. So I talked to you guys that this was coming in a prior video to give you warning, not so that you can be panicked because that's not what it's about, but so that you have the information to prepare and set your family up right and make the right decision. So some of y'all made some decisions because according to the latest stats, the insurance carrier Blue Cross has reported a 20 to 30% reduction in its customers already. And that's probably because people are choosing more affordable premium plans. And Blue Cross, your numbers be high. But apparently Blue Cross's numbers are higher because they took on sicker customers. So apparently it's not just them wanting more funds, even though these insurance companies can be a lot more affordable. But apparently it has to do with the clientele that they tend to have on their plans. That being said, a drop from 20 to 30% is very alarming. And why is that alarming? Because that means people are not getting the plans that they need to take care of their chronic diseases, but are making financial decisions to cover the bare minimum. And when it comes to your health, the bare minimum is just not enough. Listen, they are estimating that the drop, even though the government has not reported any recent numbers, but that's a whole other situation. But according to analysts, the drop could be anywhere from 24 million people in the ACA to 19 million people. Listen, already they are certain that 1.2 million people have dropped out of the marketplace coverage. And marry that with the rising cost of healthcare, this is a lose-lose for everyone. And not in a good way, but in a way that affects lives. And remember, the estimated loss of life was 55,000 annually. Y'all, this is very serious, and it's not just about the finances and health insurance plans. It's literally about survival for some people who have very serious chronic diseases. It has been estimated that already 9% of individuals who used to be able to get insurance on the marketplace are now uninsured. What does that mean? That means ballooning healthcare costs as people utilize places like the emergency care rooms and urgent cares to supplement their health care, which is way more pricey and oftentimes unaffordable. And if those bills don't get covered, the community eats up those bills. Hospitals close, clinics close, practices close, and the citizens of those communities lose their healthcare access. And what happens as a result of that? There are more healthcare deserts. And again, people don't survive. But your government ain't reporting none of that. But we are. So let's talk about the next topic. Speaking about the government, did you guys hear about the RISE ruling? Yes, the U.S. Department of Education has finalized the RISE ruling as of April 30th of this year, and the policies and rulings are going to take effect by July. So we're talking the incoming year of new students. What does this mean? So what they did was redefine who they consider to be a professional. So we all agree with the people who are on the professional list. It's a no-brainer, right? It's your veterinarian, your pharmacist, your doctor, your dentist, your clinical psychologist, your optometrist, your optometrist, your podiatrist, your theologist. I didn't really think that was going to be on the list as a serious professional degree, but it's on the list. If it's on the list, then we need to have more consistency in the theology that's being taught, but that's a whole other situation. Anyway, getting back to the topic at hand, because I may have digressed. That being said, what's really concerning and what's really alarming is the list of professions that we all, I think, would agree are not only necessary, but are clearly professional by the requirement of studies and the cost of education that they have incurred. And the logic of the Secretary of the U.S. Department of Education is that by making the by increasing the barrier to funding for education, that somehow that's going to decrease the cost of education. That's never been proven to be true. What ultimately ends up happening is when people max out the federal funding support to be able to obtain loans, these are grants, to obtain loans to be able to go for their professional or what we deem professional degrees, they then will turn to private funding sources, to private loans who are way more predatory, right? And have much higher rates, don't have as much allowances for forbearance and things like that. And so it puts people in greater debt. So that's why this is that important. It's also important because if you deem something no longer a professional degree, you may impact the salaries. So you're talking about people's livelihood. So if I can't get the funding I need, and I'm more likely to get a lower salary because now you have redefined my profession, then that means it's going to be harder for me to pay back the loans that I do have. And those loans can be predatory. And that's going to change the decision of a lot of individuals who do not come from financial well means. Those who are more disadvantaged, which is oftentimes your minoritized groups, which is primarily your minoritized groups, will likely decide not to go into these professions anymore. And we've talked about the desperation of trying to increase the number and the representation of us in these professions, like your physical therapist, like your physician assistants, like your entire nursing degrees, which include your nurse practitioner. And that's a little trifling to rely on the nurse practitioners and the physician assistants to cover the gap in your lack and shortage of certain physicians, but then don't give them the acknowledgement as a professional degree. So they're taking care of the patients that doctors typically take care of, and they are allowed to work independently, taking care of your diabetic, your hypertensive, taking care of your pregnant patients. The list goes on, but they're not a profession. So you have a non-professional taking care of people. I mean, that doesn't make sense. You have someone who you don't consider to be a professional taking care of people's health. Well, that may be because you have other shady things coming, which I'm going to get into in a moment. But that being said, these professions are deeply necessary. So the CRNAs, which are the anesthetists that help to put you to sleep for certain procedures, they're not considered to be a professional degree. They put you to sleep for surgery. For U.S. Department of Education, this seems like one of the most uneducated policies and decision making I have ever heard of. Like, do they not know that the range of nursing degrees, the doctorate nursing, that literally puts you to sleep for surgery, manages your healthcare? Anyway, let's get down to some of the other details because I will stay there for a while. So ultimately, now what happens is the professional degrees can cap at $50,000, which doesn't even cover a lot of professional degrees. I can tell you that would not have covered my cost of becoming a physician at all back in the day. And I'm decades in. Did y'all hear me? I'm decades in. And that $50,000 cap did not and would not have covered my education at the time. So could you imagine the cost of education now? I mean, it's just it's and why they determine certain fields. So chiropractors, which I love and I deem also professional degrees and deeply necessary, are a 4-year degree. CRNAs are required to get a doctoral degree. Yeah, they're not considered to be a professional degree, but chiropractors are. It's just the list just seems so random, and some people would say targeted because the fields that are not deemed professional degrees tend to be more heavily pursued by women. And so if women aren't able to pursue these degrees and being able to afford their education, they're less likely going to, and they're less likely to enter these fields. Um, and then engineer was on the list, y'all. How is engineering not a professional degree? This just seems so random. The engineers that are responsible for infrastructures, the engineers that's responsible for our safety in so many ways are not a professional degree. If y'all understand the reasoning, let me know because this just seems so bizarre in so many ways. Anyway, let's get back into this. So the new cap for those that are not considered to be professional degrees is 25,000. So again, it shifted from 50,000 for a professional degree to 25,000 annually for one of the professions that's listed on the no longer professional degree list. Now, those who are already in the profession, clearly this doesn't affect them, but this does affect those who are pursuing these fields, especially the upcoming classes. So it's very possible that you're going to see a drop in registration and enrollment of individuals pursuing these professions. And that's a shame because not only do we need these professions desperately, like there is no doctor without nursing, not at all. Doctors cannot work or function effectively without nursing. So the loss of nursing as a whole as a professional degree and the potential disenrollment in that particular career is likely to affect your healthcare directly. And let me tell you why. Because if we are no longer able to fill the gap and the deserts with these professions to help us even survive, especially in primary care, you're going to see greater deserts. You're going to see greater losses of access to healthcare in communities, especially in rural communities and in urban communities. Because if my income may be impacted, then guess who's less likely to have competitive income? The groups and organizations, clinics, and practices that work in the community, that work in the urban areas, and those that work in the rural areas, which means they're less likely to seek employment in those areas and those communities, and are more likely to go in the more competitive academic and private practices. So this is really concerning, likely for many of you who live in these communities, because the loss of healthcare providers is going to impact your access to healthcare, which means you have to travel further, you have to wait longer to be seen. And we're already seeing these issues even now. And can I tell you the cap, even at 50,000, is subpar? Because if you look at the range of cost for nursing degrees, it can be low as 22,000, yes, but it also goes up to 52,000. And that doesn't include the cost of living, the cost of surviving. That's your direct cost of acquiring the degree, which a lot of people can't work at the same time or don't have the ability to work at the same time because of the demands of learning and matriculating through these careers. And so they also have additional costs just to supplement their living, very basic living. Okay. So that's a deeply so that's already a huge deficit. And when you look at the CRNAs, again, the people that put you to sleep, their training can be anywhere from 30,000 to 60,000 annually. So there's already a deficit, which is why a lot of these individuals go into the loan replacement program, which already has been gutted. And so even the solutions to even the solutions, even the prior solutions to fill out the gap has already been eliminated, which makes this even more of a difficult decision for those who truly have the passion. And those are the ones we want, but may not have the financial ability to pursue these careers. Anyway, there's lots more to talk about, so let's get into those. Did you guys know that the EPA has been checking for your birth control in wastewaters? Okay, so the EPA got a new list of medications that they are now required to monitor for in the wastewater. And I'm gonna explain to you why this may be insidious and definitely something for you to pay attention to. So the EPA got a list that includes not just the AB pills, which now we see what happened with that. Now they have struck down the ability to mail the AB pills, which again, the numbers have already shown that doing things like this increases the unaliving rates of women. It has done it historically. It has continued to do it in states that have stricter rules. So we know that this is a fact, and there is no safety gap. There's no policy to try to counter that from happening. They just essentially are allowing these policies to happen that will compromise the ability of women to survive and live. And if the women don't live and survive, guess who else isn't living and surviving? And guess who else may have lost a mother? Mother's Day is coming up. Let's think about that real seriously. But why may they be doing this? Because some people speculate that they may be going after birth control pills next. It is speculated that the reasons why they're starting to quote unquote monitor the presence of birth control and hormonal medications and this is the thing. How are they going to differentiate hormonal medications that treat hot flashes, mood changes as a result of perimenopause and menopausal changes versus your traditional birth control? I mean, apparently they studied to have assays, but do the assays really distinguish between the two groups? So how are you going to determine what's coming from hormonal management of menopausal and perimenopausal changes versus those for birth control management? That's a whole other situation. They just don't really seem to care. And because they don't care, we need you to care so that you can raise your voice and help protect our freedoms, essentially. So nonetheless, this is why they don't allow us to be seen, because they don't want y'all to know this type of information, period. Um, you let us know in the comments. I want to know, why do you think they're starting to monitor it? Why do you think they want to monitor birth control? I mean, a lot of people really do suspect that they are going after birth control next, and they don't want women to be on birth control because they want to force women to not just be preggo, but to also not have support or a system that helps them to protect their livelihoods. And we will continue to see very high maternal mortality rates. That's already one of the highest in the entire world, and also higher than any other developed country. But apparently, they don't care to fix that. You may want to think about why. The other thing that they're doing that's really interesting and an interesting application of the law is, did you guys know that they are also looking in certain states? Now, I'm bringing this up just to give you context as to where a lot of policies and laws are going. But this got thankfully shut down last year. But did y'all hear about the law, a proposed law in Montana last year? That Montana 609 bill? That Montana 609 bill? Listen, y'all, they try to say that if a woman were to cross state lines, that she was essentially trafficked in an unborn child. That if she was to cross state lines to seek the medical care that she needs, that that is a form of traffic in. Yet we have a whole group of survivors who have been seeking justice, whose accusations and allegations include traffic in, that are not being pursued by the government. But that's a whole other conversation. You may want to think about the inconsistencies and the logic behind such inconsistencies, because if we are really about helping survivors, then we will prioritize people who really and truly are survivors, um, and really think about providing support as opposed to criminalizing. But they continue to pursue ways to criminalize women, and it's 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 very disheartening in so many ways, because instead of looking for ways to support women so that women can have options, they continue to pursue to criminalize women instead, and the woman as if she made the pregnancy herself. There is no accountability for the men, zero accountability, zero policies produced well, I shouldn't say zero policies produced. There has been a few attempts, but certainly no laws that make the men accountable for abandoning the women to manage the life that they produce together. And yeah. And then I had a recent comment that says, did you hear how hostile the world is for men? Sir, how hostile is it? If you want to see, go ahead and look at my short that I posted recently before this particular video, and you'll see what I'm talking about. Let's go on. And before I go on to the next topic, the proposed punishment would have been 5 years in jail and $1,000 fine. 5 years in jail. Ooh, child. On the topic of survivors, I do have good news for you. Really good news. Do you guys watch the show Law and Order? Okay, fun fact. I am an avid Law and Order fan. Okay, I fell off recently a little bit because your girl's been a little busy. Listen, when I tell you I go back with Law and Order like hoops and high tops. That's my show. We used to gather around during med school and just watch the latest Law and Order. I mean, that is the show, but there is something great I want to share with you, and it's amazing news. So I definitely want to take the time to highlight this topic. Let's talk about what is going on with Law and Order and what it has to do with survivors. So you guys, on a older topic, again, keep up with us because we be talking about these things. A while ago, I would say probably even 1 to 2 years ago, maybe more than that, I did a topic where I talked about and highlighted the problem with the grape kits. So grape kits are performed when someone has been assaulted to collect evidence, and they have to be processed and then be available, the information and evidence be available for a potential case that may happen for the survivor. The problem became in a lot of states is that they weren't prioritizing the processing of these kits. And so they will literally stay in some type of storage area, warehouse, whatever, and just not be processed. And so it almost kind of victimized the survivors again, because they would have this very inefficient legal process and wouldn't be able to get their cases through. And they would wait incredible lengths of time to get the information that's needed, which made people hesitant to even do them in the first place. Listen, do y'all watch Law and Order SVU. If you are a Law and Order fan, what is your favorite series? Because there are a bunch of series. If you know, you know, you know. And shout out to Criminal Intent. I'm so disheartened to hear that they canceled y'all. My goodness, they won't leave Stabler alone. But if Stabler is available, you may want to bring him back to SVU. Now, will that happen? Anyway, I digress. Let's get back into the topic. Mariska Hargitay is doing incredible work. So what she did, she started a foundation because she's more than just an actress, y'all. And that's what I loved about it is that not only does she act on this incredible series that's been around for a long time. So the Special Victims Unit, y'all hear the sound? I hear the sound. Okay. Not only was she so compassionate about the work that she does on screen, but she took her passion for the work that she does on screen to behind the scenes. And she started a foundation called the Joy Heart Foundation. What an incredible name, Joy Heart Foundation. And over the last 16 years, they have been working tremendously, relentlessly to get the states to be more proactive about processing these kits. And they provided 6 pillars in which states can agree to correct the backlog issues of the processing of these grape kits. So the end result is all 50 states now, including Washington, D.C. and Puerto Rico, have committed to the pillars to process the kits, including not just getting the kits tested, but also tracking the kits, because they would collect the information and then the kits would disappear. I tell you, the way this world treats women. Oh my goodness. So they would collect the kits, not process them, and then lose the kits. So now these 6 pillars of these 6 pillars of objectives have been adopted by all 50 states, including DC and Puerto Rico. And we are so excited. I mean, Mariska Hargitay, you are that woman. You are that incredible woman that is a trailblazer, and we are so thankful for you, your passion, your commitment, all of your staff, your workers. Shout out to Joy Heart Foundation for the work that you are doing because this was clearly necessary and no one else was doing it. So thank you for picking up this mantle and getting your part done. You see, that's what it's about. If we all do our part, then collectively we all win. Okay, y'all. But somebody who is not trailblazing is Erica Jimenez. Erica Jimenez, come to the front of the class because we need to talk to you, girl. So I've talked also on this platform. We have done a series talking about the disparity of not just Black maternal health, but also talking about Black infant health. And if you missed those topics, make sure you go back and watch our other videos because there's lots of information we share on this platform. And you don't want to miss a single thing because there's a lot going on. In order to keep up with the newsreel of what's going on, you have to have the foundational information that you need, and we provide that here. Anyway, let's talk about Jimenez. Jimenez girl with the last name of Jimenez. What you doing in these streets? So Erica Jimenez, who has been referred to in the lawsuit as both white and Hispanic, which means, again, her race is white and her ethnicity is Hispanic. And one report said that that is by marriage. I'm not sure about it, but either way, it doesn't matter. Her race is white. So let's talk about what she is up to. So she filed a lawsuit on April 2nd of this year, and the lawsuit was filed against the Pasadena Public Health Department against their Black Infant Health Program. Now, the Black Infant Health Program was created in 1989 to combat the disparities of Black infant mortality rates. You see, it receives state and federal funding to decrease the mortality rate among Black infants. Now, you may wonder, well, does Erica have a Black child? No, she doesn't, because that could have been the logic, right? If she had a Black child, then maybe she may have the argument there, but no, she doesn't. She doesn't have a Black child, but she is mad that she cannot get enrolled in this public program. And some would say that this was a setup to be able to target these programs as they have been targeting programs that are similar to this. Now, again, we've talked about it on this platform. The Fearless Fund was targeted and was targeted by Edward Bloom. Now, we've talked about Edward Bloom on this platform and his organization, that is the American Alliance for Equal Rights. Now, it sounds like it should be a good organization, but what they're doing is tearing down every single public effort of combating disparities when it comes to the experience of minoritized groups. So their version of equal rights mean no help, even if you are on the shorter ladder and they are on the higher plank, and you can acquire property, wealth, including generational wealth, proper health care, good education, and there continues to be ongoing disparities. I will tell you, there are lots of people right now who believe racism no longer exists, even though the numbers are still out there. And we may talk about the numbers also because the government is no longer collecting the information when it comes to certain outcomes, which means if you don't collect the information, then the problem doesn't exist, and they can further justify these types of attacks on our community. Anyway, so one of the things that you should be aware of is that the same organization, under the leadership of Edward Bloom, have recently settled a lawsuit with the American Bar Association. Now, why did they settle a lawsuit with the American Bar Association? You may ask yourself, well, let me tell you. Because they sued the American Bar Association for a scholarship that was geared towards diversifying the legal realm. So now they are making it harder for us to have equal representation in the legislative branch of the government, to have more lawyers that look and understand our journey and our plight. They're now creating barriers in that situation as well. So now the American Bar Association has settled with them, which means that they now remove race as a factor in diversifying our lawyers. So how do you diversify? You ignore one of the most egregious disparities in the United States. This is why we need to pay attention to when those lawsuits happen, because they make the way for lawsuits like this. They make the way for the Erica Jimenez to exist and to further attack our well-being. Now she had filed a lawsuit. This one is not under Edward Bloom's practice, this our legal fund. This is under the Pacific Legal Fund. Now, why you need to know the Pacific Legal Fund is that they have over 100 employees and about over 35 attorneys. And I think about 19 people on their board. And I look through their employment. Yeah, you can go and look and see what type of representation they have. It is not a surprise that they are pursuing this particular lawsuit, need I say. So I definitely had to go look them up to see what type of law firm would take up such a lawsuit. They have a history of choosing cases like this, cases that go after affirmative action type policies and organizations. We see you, Pacific Legal Fund. We see you. You may want to start by hiring people that looks like us so you can really understand better and perhaps have more insight as to why these organizations exist. So if you didn't, let me clue you into it. It's known, very well known, that the Black infant mortality rate is twice for Black infants compared to white infants, particularly led by issues like low birth weight and preterm birth, which are linked to disparities that make it harder for Black women to complete childbearing at a survival rate of being full term. This is a known fact that has been followed by the March of Dimes and have been very well reported on. So these programs become necessary because if you truly want Black infants to survive, you would initiate programs and initiatives that target the improvement of that, right? That help Black infants to be able to survive, which is why Edward Bloom also targeted the Abundant Birth Project. Yeah, we talked about that too. The Abundant Birth Project also received a lawsuit, and that organization targeted providing financial supplementation to women who were at risk, and they had to deal with this situation as well. So this is not new. This is ongoing, and probably we should really pay attention to these lawsuits because they're telling as to what the ultimate goal is, and it's to completely dismantle any social organization from receiving state and federal funds to be able to address these areas of disparities. And so if you really want to think about it logically, I'm not a lawyer and I don't play one on TV, but what I do have is a logical mind. And I would say that it is of public interest, unless you're ACEs. It is of public interest to help Black infants to survive. The studies have already shown that especially if Black infants are cared for by Black physicians, they tend to survive better. So increasing the funding of Black physicians going into pediatric may be a fix. We also know that the survival of Black infants improve when they are breastfed. Breastfeeding in general decreases the infant mortality rate. So clearly that's a non-brainer, right? So making sure that Black moms have the availability to have longer maternity leaves so that they can establish a good breastfeeding pattern and are less likely to discontinue breastfeeding early. Maybe giving them the social support, the insight, the education that they need to understand how to breastfeed and how to overcome some of the challenges of breastfeeding that can ultimately help to save infants. These programs are necessary if you care about the survival of Black infants, if you care about the survival of Black babies. These funding programs are necessary. And the reason why they're necessary is because it's in the public's interest that Black infants survive. It is costly to have preterm infants in the NICU. It is very costly. It increases the healthcare costs to have a NICU stay. So if you decrease the likelihood of preterm births, which improves the survival rate of Black infants as being one of the primary factors that lead to the high mortality rate, then you ultimately can decrease the costs related to preterm births, which Black women are more likely to experience as a result of the experience of being Black in America. And all the ageism like this that increases their chronic stress on a daily basis. And chronic stress has been linked to preterm birth. That has been linked to poverty, which Black women are more likely to experience and then have low birth weight infants. If you supplement and give them the programs that necessary so that they have healthy foods and access to foods, you will decrease the infant mortality rate. That's just a thought. Let's get into a few more things. Talking about Black infant, we welcome to the earth Jonah, but Jonah's entrance to this earth is not a happy story. So let's talk about Jonah. Jonah is the child birthed by Kiara Brokenbrough. Kiara Brokenbrough is a Black influencer and her husband, Joel Brokenbrough, whose video of their wedding became viral because they made it known that you can have a beautiful wedding just for the cost of $500. So their wedding video went viral and their story went viral in 2022, 5 years after meeting in 2017. The world loved both Kiara and Joel and loved their love story and what their love story represents. That really the whole point and the beauty of the wedding day is the marriage, the union, the presence of people who love you and support you. Her dress was $47, his suit $100. They made a celebration at the reception at a local restaurant in which they asked their guests to pay for their own cost of their meal, which their guests who loved them were happy to do. Their wedding, a beautiful scenery overlooking the Angeles Crest Highway. Very simple, but definitely not simple in how beautiful and how symbolic it was. So the world celebrated them, celebrated their $500 wedding, and just how they represent the reminder of really the importance of that beautiful day. Now the world grieves the loss of Kiara Brokenbrough. It was first reported that she passed away as a result of childbirth. That detail has now been countered by the Times, which is saying that that conclusion was inaccurate. We still do not know the details of her passing. The family has not released the details and are asking for their privacy in this matter. Now, they were relocating from West Virginia back to California. They were in the process of doing so. That is as much as we know. Their wedding took place, as I mentioned, in California, and then it sounds like they had relocated to West Virginia and were heading back to start their family. Now, after being married in 2022, they're expecting their first child this year, 4 years later. And they were excited at the expected birth of their child in June of this year. But something happened, and that something led to the passing of Kiara. She passed at the age of 32, a young, beautiful Black woman, and she gave birth to her son, Jonah, who was placed in the NICU as his early arrival required more intensive care. Now, her husband, Joel Brokenbrough, did say that doctors did incredible work to aid in the arrival of Jonah. So it sounds like something miraculous happened that led to the birthing of Jonah, and we are so thankful for that. And at the same time of being joyous at his arrival, the world is mourning the loss of Kiara and her impact on this world at such a young age. So this video I'm dedicating to her. It just seems, oh my goodness. Sorry, you guys. That, that hit me hard because these stories are so impactful, and it just seems like the struggles of Black women in this country just never seems to end. And even though we don't know the details of it, we know that our lives are so compounded by just the effect of being, impacted by so many disparities that almost everything that leads to the unaliving of Black women has oftentimes something to do with some disparity that exists in this country. But that being said, let's get into another important update. So you guys, those of you who are on Medicare, I have an update for y'all. Yeah. Have you heard about the access model? So the access model is going to be implemented in July of this year. So you need to know about that model. And what it is, 150 companies have partnered with CMS, right? So CMS manages Medicaid and Medicare, and they have partnered with CMS, and these are software companies or have tech availability companies that are going to be managing, if they are approved, or set to manage chronic diseases. So that would be your chronic disorders like your hypertension, diabetes, pain management, and depression. And basically, they would matter. And so basically, these companies would manage your chronic diseases separate from your doctor. Your doctor would get like $100 rebate back, which is nothing compared to what your doctor would annually get for taking care of you directly. So this is not a win for physicians. And these companies will get $180 to $420 per year per person. 180 to 420 per year per individual that they manage. They would get half of that will be withheld until they meet certain outcome markers, which we don't have an issue with outcome markers, right? We don't, especially if you make sure that we can all meet those outcome markers. That's really what matters. That's really what matters, right? So that we get that equity in care. That was sarcasm, y'all. Um, so they are geared to start this program in just a few months from now. And the question is, how do you guys feel about that? Right? And they're not traditionally healthcare provider companies. They either partner with healthcare provider companies or they themselves have been in the tech healthcare world and are geared to take on this task. And this includes your companies like Noom, Headspace, Doctronic, and Whoop. So let us know about how you feel about the fact that these companies can directly approach you, target you, enroll you, and manage you separate from your physician. Is this the healthcare model that we want? Is this the healthcare model that we want, that these tech-enabled companies take over your healthcare? I want to know. How do you feel about that? I do have good news though, you guys, talking about healthcare updates. So I give you a little bit of bad, the ugly, but I also give you the good. So the good news is we talked about a case where two moms were forced to have C-sections against their will due to court mandated decisions. And so one of those cases, the most latest case was Sharice Doyley. So Sharice has posted an update with regards to her experience, and she has obtained legal counsel and is moving forward with a lawsuit. Not only did she do that, but she started a GoFundMe so that she can afford the lawsuit, right? Because these are big cases. You got to bring in the big lawyers, and the big lawyers come with big fees. And that oftentimes is the barrier for most of us, right? Where we can't fight the cases like this that can have a true social impact and help others, not just ourselves, is because we don't have access to the lawyers to the big lawyers that can really take on these cases. So she started a GoFundMe. If you still want to support her, you can go to her social media platforms so that you can participate in the fundraising. But she was able to raise a considerable amount that would help to take care of her family while she goes through this battle on behalf of not just herself, but the rest of us, so that no other woman should have to endure this type of experience ever again. That's the goal. That's the outcome we want. We want women to be able to make decisions about their health care on their own. We want women to be able to be trusted with their own child. I mean, it's just, anyway, that's a whole other conversation. We're not going to get into the depths of that. But what I do want you to do is, if you haven't done so already, go ahead and click the subscribe button, give us a thumbs up, and go ahead and share this video with your community, whether that's your family, your friends, your coworkers, whomever. Don't forget to click that notification bell so that you are the first to get these updates, because as we tell you, things are changing, policies are changing, these platforms may be changing very soon. And so we want you to be able to make sure that you have access to these types of platforms to get this type of information. Now, let us know, what are your thoughts about the things that we talked about today? I talked about several issues, and I hope that you have been, and I hope that you feel enlightened about these issues, because a lot of platforms are not talking about these things, and if they are, we're not getting the visibility that we need to get. So make sure you do all the things. Make sure you go ahead and boost this video. If it's giving you an option to hype us up, make sure you hype us. Don't forget to hype us up, because when you hype us, it pushes this information forward. Do it while we still have the option to do it, because things, like I said, are changing. That being said, this is Dr. T, the hand behind the handle of Healthy Bump Club right here on YouTube and healthybump.club on Instagram. We thank you guys for joining me today, y'all. Thank you for hanging in there. And I hope that I was able to edify you with this information, and not just edify, but empower you with this information so you can make the right decisions that you need to make to optimize not just your health, but the health of your loved ones and your community. I thank you so much for watching, and I hope to see you guys when the next episode. And go back and watch those other videos, because some of y'all need to catch up with the rest of the class. I'm just saying. Bye. This is Dr. T, just a friendly reminder. Don't forget to comment, like, and share. And go ahead, why not? Click that subscribe button. Help us to get to the next 1,000 subscribers. We thank you guys for supporting.